but I'm hesitant to start insulin. I'm getting older. I am a 60-year-old man, and I have reservations about it. I've already discussed this with specialists at the hospital, and they've made the same decision. However, I still don't feel comfortable with it, so they referred me back to you.
Step 2, screening. The doctor thinks, does he have hidden agenda or delusion and/or stress? ICE technique.
I understand your concerns, Mr. We need to find a solution that you are comfortable with. Before we proceed, I'd like to ask you questions to better understand your situation. Firstly, what do you think is the reason for not being able to control your diabetes?
Well, Doc, I've been doing my best to manage it. I take my medications regularly, watch my diet, and exercise. But it just seems like no matter what I do, my blood sugar levels remain high.
I appreciate this, Mr. Sammy. It can be frustrating when you're doing everything right, but your diabetes isn't under control. I'm afraid of not being able to control your diabetes.
I worry about the long-term consequences, Doc. I don't want my health to deteriorate further, and I don't want to burden my family with my medical issues. It's a constant source of anxiety for me.
I understand your concerns, and it's natural to feel that way. Now, what do you expect me to do for you regarding your uncontrolled diabetes?
Well, Doc, I hope you can find a solution that doesn't involve starting insulin. Maybe there's another medication or treatment option we can explore. I just want to get my diabetes under control and avoid any further complications.
Doctor's notes. All answers were within the logical thing and normal, no hidden agenda or delusion. Stress screening.
Thank you for sharing your thoughts, Mr. Sammy. I appreciate your honesty. Now, I'd like to ask you a few more questions to assess your overall well-being. These questions will help me understand if any underlying stress factors might be affecting your health.
Sure, ask away.
Sleep indicator.
When you put your head on the pillow, do you sleep well, or do you have difficulty sleeping?
I have difficulty sleeping, Doc. It's hard for me to fall asleep.
Do you find that your sleep gets disturbed for no apparent reason?
Yes, sometimes my sleep gets disrupted without any clear cause.
Concentration and performance.
Have you noticed a decrease in your concentration and performance lately?
Yes, Doc, I have. It's harder for me to focus and perform tasks like I used to.
Indicator.
Have you become more inclined to sit alone before?
Yes, I have. Even though I used to be sociable and enjoyed being around others, lately I find myself wanting to be alone often.
Have you noticed yourself becoming more easily provoked? Do you get upset quickly and find it difficult to handle discussions like before?
Yeah, Doc, I've noticed that. I tend to get upset more quickly and find it harder to handle disagreements or discussions without feeling overwhelmed.
Doctor's notes. Anyone who said yes, there is a positive for stress screening. The patient experiences difficulty sleeping, decreased concentration, increased desire for solitude, and heightened sensitivity to stress. In conclusion, from step 1 to step 2, Sammy needs mental health care and has moderate severe stress. Step 3, scoping. The doctor thinks, does the patient need to be referred to a psychiatric clinic or stay under the family doctor?
Thank you for answering those questions, Mr. Sammy. Based on your responses, it seems that you're experiencing moderate to severe stress. It's important to these stress factors in addition to your diabetes management.
I never really thought about stress being a factor in my health issues, Doc. I always contributed it to my diabetes. but I guess it makes sense.
Yes, stress can have a significant impact on your overall well-being, including your ability to manage your diabetes effectively. In this case, I believe you should receive mental health care alongside your diabetes treatment. However, after assessing your symptoms, I don't think you need to be referred to a psychiatric clinic. You can continue under my care as your family doctor.
That's a relief, Doc. I trust your judgment, and I feel more comfortable continuing with you.
Doctor's notes. Sammy has no suicidal or psychotic dementia symptoms or drug abuse. The patient requires mental health care for moderate severe stress, but can stay under the family doctor's care. Step 4, diagnostic. The doctor thinks, does the patient have depression and/or anxiety?
Now, Mr. Sammy, I'd like to discuss your emotional well-being. We need to understand if you may be experiencing depression or anxiety. Please answer the following questions honestly. Inside you, do you feel happy and relaxed, or do you feel uncomfortable or unhappy?
I don't feel as happy as I used to, Doc. I often feel a bit down and uneasy.
Have you noticed if the things that used to bring you happiness still have the same effect on you?
Not really, Doc. It feels like the things that used to bring me joy don't have the same impact anymore.
And how would you describe your overall state of mind? Do you feel relaxed, or do you feel tense and anxious most of the time?
Most of the time, I feel tense and on edge, Doc. It's hard for me to relax and feel at ease.
Lastly, do you often feel fearful about the future, specifically regarding your health and your family members?
Yes, Doc, I do. I worry about what might happen to my health and how it could affect my family.
Doctor's notes. The patient reports feeling unhappy, decreased enjoyment in previously pleasurable activities, feeling tense and anxious most of the time, and fear about the future. Conclusion. Sammy has anxious depression. What is its classification? As the patient has moderate stress then, the final diagnosis was moderate severe anxious depression. Step 5, management. Doctor thinks, what is the management strategy? As the case is moderate severe and no drug use affects and no precipitating social event.
Based on your responses, Mr. Sammy, it appears that you have symptoms of both depression and anxiety. This is known as anxious depression, and it falls into the category of moderate severe. You must address these mental health concerns along with your diabetes management.
I never realized I was dealing with a psychological disorder, Doc. I always thought it was just the stress of life and my diabetes causing my discomfort. It's a relief to have some clarity now.
It's understandable, Mr. Sammy. Mental health concerns often go unnoticed, but they can have a significant impact on our overall well-being. Now, the recommended management strategy for your anxious depression is to start you on an antidepressant called escitalopram at a low dose of 5 milligrams once daily. Additionally, there are non-pharmacological strategies that can be helpful, such as sleep hygiene, regular exercise like walking, relaxation therapy, like deep breathing exercises, supporting your self-esteem, and avoiding arguments or stressful discussions.
That sounds like a comprehensive approach, Doc. I'm willing to give it a try. Anything to feel better and get my diabetes under control.
Great, Mr. Sammy. We'll work together to help you feel better, both physically and mentally. Now, we will also schedule regular follow-up visits after 2 weeks with instructions to keep monitoring blood sugar levels.
Thank you, Doctor. I'll monitor my blood sugar and see you for the follow-up in 2 weeks.
Doctor's notes. Management strategy includes starting the patient on escitalopram 5 milligrams once daily. Non-pharmacological strategies such as sleep hygiene, exercise, relaxation therapy, Self-esteem support and stress management are also recommended. In follow-up visits, after 14 days,
Good morning, Mr. Sam. I'm glad we got together today.
It was a pleasure meeting you today, Doc.
I see here in your records that after 10 days from the beginning of the antidepressant, you experienced symptoms of hypoglycemia. To address this, we plan to decrease the dose of your sulfonylureas and closely monitor your blood sugar levels.
I truly appreciate your dedication to finding the right approach for me. It makes all the difference.
doctor's note. Plan to decrease the dose of sulfonylureas and monitor blood sugar levels closely to address hypoglycemic symptoms. After 2 months,
Hi, Doc. Thank you for seeing me today. I am encouraged to see you again. I would like to update you on my health since my last visit. I have to say, Doc, after starting the treatment for my depression, I've noticed a significant improvement. All my depression symptoms disappeared after 2 months, and I feel happier. My blood sugar and HbA1c are also down to 7%.
I'm glad to hear that, Mr. Sammy. It's heartening to see the positive impact that addressing your mental health concerns has had on your overall well-being. Sometimes the focus on physical symptoms can indeed overshadow the importance of mental health.
patients' comments.
The last time I laughed heartily like that was when I was 15 years old. Unfortunately, throughout my suffering with diabetes, and before that, it never occurred to me that I was suffering from a psychological disorder. I used to think that life was like this, and that the obligations of this world were the reason for my psychological discomfort. The great mistake that doctors blame is that the length of my diabetes treatment did not occur to a doctor if he asked me about my performance and my psychological comfort. I started all doctors focus on diabetes and its symptoms and claimed that I did not adhere to their advice despite my full commitment. I'm grateful that we could identify and address it in your case. I'm grateful too, Doc. I'm finally able to enjoy life and spend quality time with my family without the burden of constant worry. Thank you for your support and expertise.
You're most welcome, Mr. Sammy. It's been a pleasure working with you. Please continue to follow the management plan for anxious depression, including non-pharmacological advice and taking escitalopram as prescribed.
In the present time, Sammy lives his life happily and spends most of his time with his family. He receives visitors. He does not suffer from sleep disturbances or psychological upset feelings. In addition, he does not use any diabetes treatment and is at normal levels. Sammy continued on the management plan for anxious depression, consisting of non-pharmacological advice and escitalopram 10 milligram with regular visits to his doctor every 8 weeks after his condition stabilized, and he reached remission status.
هذه قصة حقيقية هذه واضحة كثير من آبائنا وأمهاتنا وأخواننا وأنفسنا وجيراننا يعانون في الحكاية. المريض قال لي تعب الدكتور في النعم قال آخر مرة هو صراحة عمره 70 سنة قال لي آخر مرة ضحكت من قلبي زي ما أضحك معاك الآن لما كان عمري 15 سنة آخر مرة ضحكت من قلبي زي ما أضحك معاك الآن 15 سنة وكان جالس مع أولاده في المنطقة الشرقية عندنا في الخبر زي ما تقول كان ينتظر الموت أولاد زوجته وأولاده وبعضهم في المنطقة الجنوبية وجالس مع ولده يقول والله بشرك نشوفهم في المنطقة الجنوبية وصرنا نتمشى ونروح ونجي السكر الآن وقفنا صار حبي حيستمر الناس ترجع ثم الناس موجود اي سؤال او اي شو اللي استفدناه من الفيديو؟
احنا خرجنا من الموضوع الطبي طبي اجتماعي طبي نفسي شامل اجتماعي ثقافي كل هذا الريبورتاج هذا معناها حسب معناها النتيجة معناها بعد اتباع هذه المراحل نستنتج كل الأمراض يمكن التعاطي معها الأمراض العضوية معها بالطريقة هذه وصلنا معناها طريقة مغايرة التعامل مع المريض. احنا عندنا طريقة
كلنا درسنا عليها. نعم.
المريض وبعدين نمر مباشرة إلى الوصفات الطبية. يتم تعليمنا في الجامعات أن نعطي مساحة كبيرة ننتظر كلنا الخلاصة بتاع الدرس هي فري وننتظر الدواء اللي سأعطيه لمريضي كي يشفى. لكن انقلبت الآية، أصبحنا نعطي أهمية للتمشي الغير دوائي.
ولكنه يعني ما في مراحل
تفادي الأمراض الخطيرة، الأمراض المستعجلة، الأمراض ثم نمر إلى الإنصاف التمعن في الأبصار.
ما شاء الله الحالة يعني كلنا على فكرة من أمريكا إلى اليابان اللي عايشين للأسف الكليات الطبية، وهذا كلام المنظمة الصحة، إن الجسد زي ما سمعت البروفيسور فصلت الجسد عن النفسية وفصلت إنه خلاص ما دام قال أعضاء ما كنت أفكر الكبد في هذه المنطقة الظهر الأعصاب أو العظم أو البيض صح ولا لا؟ أي شكرا لك كلام من أي كلام 100% وهذا هو الواقع.
أنا عندي علم كذا ولا شيء عندك في مسألة معناتها تاخذ في الجواب هذا يجي مع النظر شوية تدريب نفسي وأنا نفسي كأنها تضربني أنا هو اللي مش هعتمد
إذا الخلل فينا نحن هي مش متقبلة هذا شيء آخر، لكن تروح تتحول للطبيب النفسي زي مثلا تقول للواحد أنت عندك زايدة أنا ما عندي لازم تروح للجراح حتى لو رحت الجراح في الخلل فينا يعني وهم في الطب النفسي الآن بيعانوا و3 4 أو 90% يعني الأطباء النفسيين إلى روسيا 3 4 الحالات المفروض تكون هناك. أنا من اللي منعني من القلق والاكتئاب؟ أنا شخصيا لما كنت أدرس في كليته قلق خليش يعني وتقرأ ادرس 10 ساعات، 10 ساعات ادرس. احيانا شيء موجود، احيانا صح مثلا لما الطبيب النفسي لا ما مجنون مثلا، يعني احترامي للمجتمع، تروح عند الطبيب النفسي يا جماعه. الدراسات العليا في طب الاسره السنه الثالثه، يعني تخيلوا سنه واحده واتخرج، جانب الله يرضى عليك انا عندي حاجه نفسيه. ليش؟ قال انا صرت باكل فوق السطح زملائي، زوجتي واولادي في مسافه بعيده، قادر ناس عنده مهارة اجتماعي ونومي متلخبط وحالتي طيب السكر احنا عارفين عندك مرض السكر، ما عندي. عندك ضغط، قال لي ونحن 3 أنفار ما ادري 4 أنفار اخصائيين استشاريين. والله المريض نفسه يقول لي ما مش عيب تسالوني عن الحاله النفسيه حالتي. طيب انت عندك مرض ربو؟ ايوه الحمد لله يا رب لك الحمد. طيب طخاخ واحد يقول يا رب يقول واحد عشان اضيف له الطخاخ الثاني، قال لا بس قفل علي. طيب بتردوا كذا ولا بتردوا كذا؟ والله لما اتذكر انا بتكلمكم عن نفسي انا، فما والله لو واحد مسكني من هنا كذا ومسكني على الباب وشافني برا ما حق، يعني هذا اللي مسكين يعاني واحنا في وهابش، رغم انه الاستجابه للمعالجه على مستوى المستوى اسبوعين يتحسن، 6 اسابيع 8 اسابيع، بعدين هذه اشياء عضويه